And it's time now for our 8:30 High Beam Talk with the Doc this morning, brought to you by Mako's Pharmacy at 240 East 3rd Street in downtown Yorksville. Mako is your local pharmacy with a caring and knowledgeable staff focused on your health and wellness, as is Dr. Tim McKnight. Good morning.
Good morning.
Good to have you here.
Thank you.
Even though it's a dreary day, we'll brighten it up a little bit.
Let's do it.
All right. You want to talk this morning about something that I guess we're familiar with hearing about, sleep apnea. That's the main kind of apnea, I guess, which is a non-sleeping period, right?
Right.
Or a non-breathing period.
Exactly. Apnea means you're not breathing, and it's really common. At least 10% of us have it, and left untreated, it can cause some real significant problems. And so people just need to be aware of this one, because if you're tired, if you wake up frequently at night, if somebody says you snore, or your partner says, hey, you're not breathing, and they nudge you, it's likely that you have sleep apnea. And if it's untreated, it leads to a very increased risk of atrial fibrillation, which we talked about last week, stroke, heart attack, hypertension, and even Alzheimer's disease, as well as just excessive daytime sleepiness, which can lead to motor vehicle accidents.
Right.
So real severe and terrible consequences if it's left untreated or undiagnosed or not recognized. And I think that's probably the issue for most people. They just don't want to believe they have it because they don't want to wear something to bed at night. And I think that's the big hurdle.
So we get into that, and we've heard about all the devices to help make sure. Do those actually force you to breathe, or how do those work?
Well, yes, they do. If they fit snugly, for some people just get claustrophobic. They don't want anything on their face. And depending on how you tolerate it, they have nasal pillows that basically they're a snug little fit right underneath your nose, and that blows the air into your nose. Some people don't tolerate that, or their sinuses are too congested and they can't get the air through the nose, so they have to have a mouthpiece, like breathing mask that you would have in the hospital, or like we would use to do CPR on somebody. And that's harder for some people to tolerate. And then there's some that go over the mouth and the nose. But if you can tolerate it, and in my experience, only about 50% of people will tolerate it or will let themselves tolerate it. So they're being untreated. But if you can tolerate it, it makes a huge, huge difference. I mean, I tell my patients, just think of this. Sleep apnea, there's two types. There's central sleep apnea, where your brain doesn't get the signal that your carbon dioxide level is raising. You have receptors in your blood and your arteries that say, oh, your CO2 level is going up, you better breathe. And so that'll stimulate a breath. And some people don't get that message very well. So that's a central sleep apnea, where the brain isn't telling you to breathe when it should. Because
you're breathing in oxygen and out CO2, and it's staying in there.
Yeah, so you think of this. Some people will go 30, 40, 50 seconds without a breath, and the CO2 level rises, and the brain says, you better breathe. So you will. But on the other side of it, probably 90% of sleep apnea is obstructive, where there's something that's blocking the airflow, whether it's sinuses that are just too congested because you've got a cold or you have a narrow sinus cavity, or more commonly, it's people that are overweight, big thick neck, or a large tongue that sort of drops in the back of the throat, especially when you lay on your back and it blocks the airway. Some people have a small chin, and the mouth structure just makes it difficult for airflow. Or some people have big tonsils, anything that can obstruct the airway. And again, this is more common when you're laying on your back. If you lay on your side, it's usually not an issue. So those are the two types of sleep apnea, and we have to find a way to get the air in. So if you can do that, you'll feel so much better. So I tell my patients, we score this by how many times an hour you stop breathing or you don't get enough air. So more than 15 seconds without a breath is an apneic spell. More than 50 or less than 50% of the oxygen on a breath that you should be getting is an apneic spell. So you combine all those events and you divide them over the number of hours of sleep, and you get an average rate every hour where you're not getting enough air. That's called the AHI score, the apnea-hypopnea index. Basically, how many times an hour you're not breathing enough. If it's less than 5, that's considered normal. 5 to 15 is mild sleep apnea. 15 to 30 is moderate, and overuse severe. I had somebody tell me the other day that his was 83 times an hour. That's more than once a minute. So it's like somebody's got you're sleeping at night and somebody's putting a pillow over your face for maybe 30 seconds every minute or every other minute. Or maybe it's 40 or 50 seconds. And so what happens is most people aren't aware of it, because when they can't breathe, they'll just toss or roll over, and their airway opens, and then they can breathe again. Or they might cough, or they might gag, and the airway opens up temporarily. But just imagine the quality of sleep that you have if somebody's doing that to you. And you're so tired every night. You fall into bed, and you can't get out of the bed when the alarm goes off, because you've been a light sleeper all night. You're not going into REM sleep, which is when your brain organizes your thoughts of the day. You're not going into deep sleep, which is when your body heals. So how do these people feel when they wake up? Well, their brain's fuzzy. They don't compute very well. Their cognitive function declines. And physically, they hurt, they're tired, they're achy, because the body hasn't healed. You've missed those important stages of sleep.
And you have to be aware of that, especially if no one else is around when you're sleeping, to say, hey, there might be a problem.
Yeah. And the other thing is, when you're not getting oxygen to your lungs, it will cause your body to shunt the blood, and it will actually raise your blood pressure. So now all of a sudden you've got a elevated blood pressure, and you're tired, and you're not putting two and two together. So in my case, my wife would tell me that I would snore, and every now and then a couple times I actually remember sitting up in bed feeling like I was choking. I just sat up in bed, like just a panicked feeling like I was choking. My heart was pounding, and I'd catch my breath, and I'd just fall back down and go to sleep. And finally I said, okay, I'm going to have a sleep study. I'll do whatever it takes to feel better. My blood pressure was going up. I knew that a stroke and a heart attack could happen down the road. I thought I better just have this checked out. My AHI score was a 12 on one night and a 13 on the other. So every 5 minutes I'm not getting enough air. But the average duration of not breathing for me was 43 seconds. And one of the events on one of the nights was 110 seconds. I didn't breathe.
Almost 2 minutes.
Almost 2 minutes. And I don't know if I could hold my breath that long consciously, but subconsciously I was doing that. So I had a mild case. It was bordering the moderate stage. Now with the machine, I have one of those nasal pillows, and you can't hear it when it's fitting right. I can't feel it. It's really comfortable. But if I open my mouth, or if I knock it around a little bit, you can hear this air just rushing in, and it's not a comfortable feeling. If I have a stuffy nose or allergies, I have to take something at bedtime to clear that up so it can go through my nose. But now my AHI score, last night it was a 2, which was really good. So I feel rested with 6 hours of sleep. So it's absolutely critical that if you have it, you don't ignore it, and you let us try to help you find a way to correct the problem.
And by the way, if you have one of those machines, make sure that it gets cleaned and
yes. Yeah, and there's a recall on one of them right now. Apparently, inside the machine, there was a filter that was breaking down, and the powder was being blown out into the tubing and into the lungs. And they thought that the claim was there was a couple cases of lung cancer that they thought might be associated with it. So there's a recall. But when you talk to the experts, they're like, yeah, that doesn't happen very often. But like you said, if you clean your tubing, you rinse that out. And the risk of not using a machine when there's a small risk of maybe a bad outcome is much greater than a risk of cancer. So keep your machines clean and use the machine, and talk to your provider. Have the test done. You can do these tests at home, which is what I did. It's much more comfortable doing it at home than being in a hospital, with somebody watching you in the next room, and you got leads all over your chest and things on your head, and you don't. It's not a natural setting.
I don't think that's going to work out very well.
Yeah, no.
Right.
But like I said, cognitively you will do better. Physically you'll feel better. It will relieve the stress on the heart and the lungs. The blood pressure will come down. And for some people it's weight loss. For other people it's just your body type. 10% of people have this. And it's not always a heavy person or someone with a thick neck. It can be somebody that's thin, and you would never know it. But this is one of the reasons that people develop stroke and heart attack and atrial fibrillation, and it's an easy fix if you allow yourself to be diagnosed and treated appropriately.
Make sure to ask questions.
You should, yeah.
All right. Dr. McKnight, thank you.
You're welcome.
Dr. Tim McKnight this morning as we talk with the doc about sleep apnea.